Um, should I start now?
Sure.
So this is my first webinar. This is exciting. And I want to just point out a little bit I think there was maybe a bio that said that I worked with the Canadian Association of Medical Cannabis Dispensaries and Canadians for Safe Access. And I worked in the medical cannabis industry for about 13 or 14 years now with the BC Compassion Club Society. And now I'm doing more research and policy work. But it's been in my world for a long time, and I hope to share some stuff with you. I talked to Fernando ahead of time and thought I would go through the current state of medical cannabis in Canada. So I'm going to do a little presentation on that and then maybe answer any questions you have after. The links at the side are just things that I thought would be of interest, and I'll maybe kind of explain why, as well as the articles, the documents that are attached at some point. So what I thought I would go over is a little bit about the medicine itself, just to give a little background on that, and then the landscape of what's going on in the country with medical cannabis, and then the changes to the regulations, which are of concern to people and very timely to give an overview about. We'll start with the medicine, and I just want to go over a little bit of the biological mechanisms, like how does this plant work, what's the plant all about, how does it work with the body. So the plant, we'll talk about the plant a little bit. So as you can see, there's a plant, and it's like any other plant. It can grow in your garden from clippings or from seeds, and it's got stalk and stem, leaves, flowers. And I'm just trying to demystify it a little bit. It looks a little bit more, mystified when you see so much of it growing at once, but it really is just a plant and a flower. And then getting a little closer, the next slide will show you a little bit more of a close-up of the flower, and you can to see what it looks like a little bit under a magnifying glass. And I'm getting to get even a little bit closer because this is where we can see the resin on the flower. The resin's made up of what's called stalked capitate trichome gland heads. And this is what contains all the molecules that are specific to cannabis as opposed to other plants in the resin. So there's over 60 different what are called cannabinoids. These are the molecules that are specific to cannabis. And the most famous one that we all know about is THC. But there's many other ones. There's CBD and CBG and CBN. And they really work together synergistically, along with other chemicals that are in the plant called terpenoids and flavonoids, and together these produce the effect. So we've seen some pharmaceutical companies come along and try to isolate just one of the molecules, for example, THC, and we found that the effects of those medicines aren't very good. They're either not effective or too psychoactive. So it's a whole plant, and all the chemicals work together synergistically. So this gets into the different types of strains, and this is a very important part about how this medicine works, because there are hundreds of different strains, each have a different effect, and it's related to those cannabinoids we're talking about, possibly the different ratios of THC to figure out why do these strains have different effects. Do they really? I mean, we know they do from patient experience, but science hasn't caught up with experience yet. So that's what scientists are trying to figure out. There's names that we've been giving them to kind of classify the different strains. They don't actually mesh up with the real names of the plant strains. Really, there are two plant strains called indica and sativa, and the ones that are used for the psychoactive effects and the physiological effects are really all under indica, and the sativas really are all the hemp plants. But we've been categorizing the different strains under the name sativa and indica, and they have nothing to do with those. They're the same names, but they're not really related to that kind of species of the plant. They're just convenient names to look at the different types. So what we call sativas, we categorize strains that are more uplifting and stimulating and energizing into the category sativas. and those are recommended to use more for daytime or when you want to be up and active. And all the strains that are more good for pain and relaxing and good for inflammation and spasms, we've been calling indicas. And those are more relaxing, so better for when you don't have to be up and active and doing anything, when you want to, not when you want to be awake. and then there's crosses of the two, and we'll call it crosses, and it's crosses of those kinds of strains, and they tend to be really good for nausea and appetite and focus and mood stabilization, really good for daytime use. And everybody really, when they have the choice, ideally, of all the different strains, they can find the right one or ones that work for them, for their unique array of physical and emotional and psychological symptoms. I guess ideally that doesn't happen for everybody. But these different strains do explain why cannabis can be so effective for so many different symptoms and conditions. And it also is explained by how this interacts with the body, which we'll go on to next. So how it works with the body is that there's an endogenous cannabinoid system, and this was found out in 1964. They isolated and synthesized THC, and then in 1988 they actually found that we have a receptor system in the body that can take in these molecules. So that's relatively recent, that now we realize that our body makes its own cannabinoids also. So inside our body, there's receptors, there's a CB1 and CB2, there's the different cannabinoids. Anandamide was the first one that they found in 1992, and that actually means inner bliss. And these are tracked back, the system has now been tracked back to pre-human life. It's part of our evolution. It's been found in mollusks and hydra. So this cannabinoid system, interestingly, isn't being taught in medical school. So it's a really important part of the human biology. And what it does is it regulates all body systems, particularly the nervous system and the immune system. And it's also been found the cardiovascular system, the endocrine system, the excretory, musculoskeletal, reproductive, and respiratory system, and the intestines. So this also explains why this plant can be so useful for so many different symptoms and conditions. We have receptors all over our body for cannabinoids. And the human body depends on having the cannabinoid system in balance to be healthy. And some people, like for example, the endocannabinoid endogenous, the endocannabinoid levels increased in response to head injury and stroke. So our body will say, oh, we need more of this. We're going to become more, we're going to have more receptors so that we can take in more cannabinoids. And sometimes in response to other things, the endocannabinoids themselves will increase. So there's a theory that there can be endocannabinoid deficiency. So some people can have too low levels of endocannabinoids being produced, and it's very helpful for them to take in external cannabinoids from the plant. They call this the endocannabinoid deficiency syndrome. That's theorized. So that's kind of basically how the plant interacts with the body. And then there's different therapeutic uses of it that we can just overview quickly. So there are the symptoms and conditions, how it's used, and potential harms. I didn't have a slide on that, but we can talk about that. So the symptoms that cannabis has been found very useful for are appetite, nausea, pain, spasms, inflammation, fatigue, depression, anxiety, insomnia. Those are kind of the key symptoms and conditions, or symptoms that cannabis has been found to be effective for. It also, people say it gives them energy, increases their overall sense of well-being, lifts their spirits. And these symptoms are associated with many different critical and chronic medical conditions. And also they're associated with the side effects of a lot of the drugs that are used for different conditions. There's a list of conditions that this is the ones that the compassion clubs commonly see, and that there's ample evidence how cannabis is useful or effective in treating these conditions. So this is a list that the compassion clubs have come up with that they feel that they can stand up in court and say that it is valid to be giving people this medicine for these conditions. So with pain, it does help relieve pain, and what they've found is that the cannabinoids fit into the same receptor sites as the opiates. So not only does it help,
Comments.
I can't read
getting
the
my
comments.
spirits lifted right now.
Nice. So with the for pain, it's been found that it has a parallel pathway to the opiate, so it fits into the same receptors. But also, what this does is it allows people to use less opiates. And that's huge because the opiates are addictive. They can be damaging on different body organs. And so people have found that they can wean themselves off of opiate use by using cannabis. So there's a substitution effect, we call it. And that's very helpful. It really increases people's quality of life. The side effects of the opiates can be very hard. There's a bunch of other conditions and symptoms there with mental health. Depression and anxiety come along with many other of those conditions. So, we've done some surveys and studies for mental health, for depression, anxiety, and sleep, as well as whatever their primary condition is. And that might be their primary condition as well. And, there's been some concerns around mental health. And what we have found from experience, and again, the research isn't quite caught up yet, but we've found that that's really strain related. So, for example, with anxiety or schizophrenia, for example, some strain mood disorders, and some strains can really help them. And so the people having access to the appropriate strains is very important, and the right dosages as well. I guess we'll talk a little bit about I didn't talk about potential harm so much, but we can go into that around methods of use as well. So there's different ways that people can use it, and with each way that people use it, there's a different time of onset. So, for example, when you smoke it, it might take a couple minutes to feel the effects. When you eat it, it can take an hour or 2 hours to feel the effects. How long it lasts can be different depending on how you use it, as well as the quality of the effect. So for certain symptoms and certain people and certain times of day, they might want to be able to have access to all the different ways to use it, whether it be smoking or vaporizing or eating edible products or tinctures or topical creams. There's people are juicing it now as well. I guess the emphasis, and this has to do goes into a little bit of the potential harms. They've found in studies that a researcher who was wanting to find that it caused lung damage and lung cancer did this massive study, and in the end found that it didn't. So there's no evidence that it's causing the same kind of harms that tobacco does, as long as you're not rolling it with tobacco. But people do find that it causes irritation if you smoke it, and that vaporizers can really cut down on that. Irritation. And the idea really is to use as little as you need to get the effects that you want. And that's both for any potential harms as well as costs and any unwanted side effects. So really to start with small amounts of everything, particularly when you eat it. If anybody's ever eaten too much, they know what I'm talking about. If not, what can happen is it's a lot stronger when you eat it. And the effects can last a really long time and be extremely strong and extremely uncomfortable. People can vomit profusely and just psychologically have intense anxiety, and a lot of people go to the hospital and they think they're going to die, and they're not, but it's hard to tell yourself that when you're experiencing that great discomfort. There have been no deaths associated with the use of cannabis, so it's not a scary thing, but for the sake of comfort and well-being, you want to be cautious.
So who would someone go to talk about this? People can buy marijuana off the streets, or they can go to a dispensary, or they can sign up with the Compassion Club, places like that. But where would you find out information about how much to take, what
Yeah.
types to take, things like that.
Yeah, well, right now that kind of information is really being held in the dispensaries, which are compassion clubs, and I'll talk a little bit more about those. But maybe a friend that you buy it from will tell you this, maybe not. But the compassion clubs are set up to give people that kind of information. So when people go to a dispensary, they'll do an intake session and go through all of that, in an individualized way. Otherwise, there's
You're just freewheeling
you're freewheeling it. I don't one of the websites I don't have up there, but one I do have up there that is Canadians for Safe Access, and there's links to the different dispensaries on there, and some of them have some information on safe and effective use that you can also look up online. The BC Compassion Club Society, which I think is thecompassionclub.org, they have a safe and effective use pamphlet that goes through all of that. So really people are on their own to find these things, or they can go down to a compassion club and get that kind of information.
Where did the poll come from? That must be Brandy.
Oh, so there's a poll that we put up. We're going to be asking a couple different questions throughout the session, and just asking people, the first one is that they currently use it for medical purposes. And it's looking 50-50-ish for my eyesight. Oh, 60-40. It's changing all the time. So we'll see how that one goes. Just to kind of get a sense of where people are at, and it's just interesting. There'll be some other questions also. So we'll get into the landscape now of medical cannabis. So I guess first we'll talk about the Health Canada regulations. And so there's a bit of a history around this. There was a man named Jim Wakeford, and he kind of took it on. It's all been patient-led, really. All of the kind of access to cannabis has been patient-led. So Wakeford he had gone to court, and he got the right to get an exemption from the law. So cannabis is criminalized in Canada; it's a prohibited substance. And then he was like, I need it for a medicine. He had seizures. He needed it for a medicine, and the court said, okay, you can have it for a medicine. We'll give you an exemption. And, maybe open that up to other people as well. And that was in 1996. And then Terry Parker, he had HIV/AIDS, and he was like, no, it shouldn't be up to a minister, it shouldn't be up to a bureaucrat if I can get my medicine or not. And he took it to court. And the decision was that people have a constitutional right to choose cannabis as a medicine, and not to be criminalized for that. So that was a huge win. And then it was a matter of, okay, so now we have the right, how do we access it legally? And so Health Canada came up with these medical marijuana access regulations in 2001. And what they had proposed was that people could either grow it themselves or have somebody grow it for them. So that was kind of how it started off. And I guess where it went from there, actually, was there were more court cases. And it's all been in the courts. So after that, people said, okay, well, what if I can't grow it for myself? And what if I can't find somebody to grow it for me? Because that's asking a lot. Where are people going to grow it? I have to find a home to grow it, and I have to get equipment. You don't ask anybody else to grow their own medicine. So this is ridiculous. And the court said, you're right, that's ridiculous. And at that time, I'll talk a bit more about compassion clubs, but they existed. And Health Canada said, no, it's okay, there's these illegal organizations. and people can get it there. And the government, the court said, great, why don't you put in some regulations to license those currently illegal organizations, and then everything will be perfect. And Health Canada had a year to do that. And what they did instead is they came back a year later and said, no, what we're going to do is we're going to start distributing cannabis that we've been contracting someone to grow for research purposes. We're not going to license these dispensaries. We're going to start selling this cannabis that's being grown in Flin Flon, Manitoba, in a mine for research purposes. And there have been, every time it's gone to court, the program's been found unconstitutional. The quality of the first cannabis that they started selling was below par. It was, people called it swag. It was just sticks and stems and one strain and not very effective and all ground up. and people are like, this doesn't work for us. So there have been a lot of barriers to access to the program besides, one, the quality of the cannabis being poor.
We have two questions.
Yeah.
One says, I want to know when Health Canada will start charging us to buy it
Yeah.
off them. Another person says, well, is there someone that can help me find someone to fill out the forms or to grow for me?
We're going to get into all of that, so I'll keep mind of all those questions. So where the barriers came in was that besides the quality being bad, so there's barriers to getting a good source of cannabis, but there's also barriers to actually getting your form signed, like that person asked. How do I get my form signed? Because what you needed to do is have a physician fill out your form. And I'm just going to go back and forth on some slides, but I'll go to the next slide and then come back. So they had two schedules. There's Schedule 1 and Schedule 2. And Schedule 1, you needed a doctor, and then Schedule 2, you needed also a specialist, and this was very hard for people to do. So you can see what they considered the symptoms and the medical conditions that you would need a signature for your doctor for, and then any other thing else you would need a doctor and a specialist. Originally, spinal cord injury is on there for severe pain and muscle spasms. I'm going to go back to the landscape slide, though. People were finding it very hard to get their doctors to sign this form. The colleges of physicians and surgeons across the country all told their doctors not to sign it. The association that insures doctors said, don't do it. Here's a waiver, which makes doctors afraid. So they were being discouraged. The Canadian Medical Association was also not very supportive. None of the physician organizations were supportive. So some doctors were signing forms for patients, a lot weren't, and patients were really struggling with this. And for 8 times the patients have taken this program to court since 2001, and it's been found unconstitutional each time. And the government would make small amendments that the courts either had asked them to do, and sometimes they wouldn't do the amendments that the court had asked them to do. So it just has been kind of this ongoing, more than 10-year program that isn't working for people. Just to give a little bit of depending on which study you look at, 500,000 to 1 million people in Canada that report that they use cannabis for a medicine. And Health Canada's program has at this point licensed about 25,000 people out of those to legally possess cannabis. So that's a very small number of the people who are actually using it as a medicine. So legally. So only 25,000 are legally using it, and 500,000 to 1 million report using it as a medicine. So they're not being protected. So the vast majority of people who use it as a medicine are not being protected because, we've done studies, I've been involved in a couple studies around and anecdotally talking to patients, the kind of experiences they have when they go and talk to their doctors. Some are just, they fire them. Some of them treat them like they're drug seeking. They have to shop around for a doctor that will help, will sign their forms for them. And there's some doctors out there who have decided to make a business of it. They saw that there's a gap, and some of them are filling that gap and helping patients to sign forms. And some of them are charging, well, they're all charging. They're doing it privately. And some of them are charging a lot, ridiculous amounts of money for that, which I have ethical issues with. And some are charging what they think, is kind of a fair amount that covers their overhead and, for setting up such a business. But it's still problematic that patients would have to, go outside of their normal relationships with their doctors to get access to this medicine and pay out of their own pocket just to get somebody to sign a form. It's a problem, and it's another reason why the program was found unconstitutional.
Has that been researched at all as to why people aren't signing up or aren't getting signed up? Is it because of doctors? Is it because some people just feel like they don't want to sign up? It's easy enough to do without.
Yeah, I mean, there's some research into why the doctors aren't signing, and there's been a lot of work around that. So the doctors feel like, one, they're being discouraged to by their associations. They don't feel like they have enough information about it. They're scared that They're being taken advantage of by their patients who maybe just want to use it recreationally. They don't know enough about medical cannabis. They didn't learn about it in school. They didn't learn about the endocannabinoid system. They're not used to dealing with plant medicine, fair enough. They're used to dealing with pharmaceutical drugs, and they never agreed to be part of this program. What we found interesting, though, is that more doctors will sign for compassion clubs than they will for Health Canada's program. So that's interesting. They feel more comfortable. One of the things is that with the compassion clubs, they allow doctors to just do what they feel comfortable doing, which is to diagnose the patient. And they feel comfortable sending the patient to a dispensary that can give them all the information that I was talking about, how to find the right dosage and the right strain and the right product, and they feel that there's some quality control there, so they feel comfortable. As far as why patients aren't signing up, I think you're right. A lot of them, I don't have the data with me now, but we did a survey on people who use cannabis as a medicine, and how many of them are licensed, and where one is having your license so that you can be in legal possession, and the other issue is where you get it from. So those are kind of two different things. But I think a lot of people don't know about the program. They don't want to bother. They don't want to have to talk to their doctor about it. It's very uncomfortable for them. It's an illegal substance. They don't want to get into it. And like you said, they probably feel that they have access without having to go through that. Some people are afraid about privacy. They don't want to give their information to the government. That's a big one for people. So there's many reasons, and we can get a little bit more into that.
Watch your hands. It makes a loud noise.
Okay. I won't move my hands around. Then I'm going to talk about dispensaries. That's kind of another part of the landscape, which is actually a really big part. We just did a study and looked at where people get their cannabis from, and it looks like about of the people we surveyed, about 50% are getting it from dispensaries, and 30%, or actually 30% are getting it through Health Canada's program. These are probably not mutually exclusive, but of people who have authorizations from Health Canada, 75% are getting their cannabis from dispensaries. So that's huge. Some people are growing it for themselves. Some people are having people grow it for them, and about 3% are actually buying the product from Health Canada. Again, it's one strain, and people don't find one strain and that particular strain very good for them, and the quality is not what they like. So they're not buying it from Health Canada. The majority aren't growing it for themselves or having somebody grow it for them. They're buying it from dispensaries. They've been around since before the program, medical cannabis dispensaries. They started in California, where they had Proposition 215, and they got legal cannabis in, I think, 1996. And the founder of the first compassion club in Canada, and she went down to California and then said, hey, I'm gonna establish this up here. And so in 1997, the first dispensary opened in Canada. It was the BC Compassion Club Society here in Vancouver. And it got a lot of support. In 2003, the Senate, the Canadian Senate, did a report on drugs and on cannabis in particular, and their recommendations were to work with the dispensaries, to involve them in research, and to license them. And court cases have come up with dispensaries, and either the suppliers of the dispensaries ended up charged or the operators of the dispensaries, and each time they were given absolute or conditional discharges, with the judges saying, keep up the good work, you're filling a gap, you're doing good work, and to do that, to keep the doors open, these dispensaries have to be very meticulous. But they are not part of the legal framework. They're considered, it's kind of interesting because the terminology we used about ourselves was we're in a legal gray zone, because we're not licensed, but we're upheld by the courts. So it's a really interesting position to be in. We can be charged because it's not legal, but when we go to court, the courts are like, we're not going to give you any penalties. So I was just looking at one of the latest reports from Health Canada. They have a cost-benefit analysis, which is, there's a link to that there, the CBA final report in the documents. And they're now referring to compassion clubs or dispensaries as the gray zone. So it's an interesting thing, and I guess again, these dispensaries are a really big part of the medical cannabis system in Canada. They are serving 75% of people who are authorized, and an additional 50% of everybody who uses it, based on our studies.
Rielle, stepping back a second to the doctors signing off on the forms. That's a big discussion amongst the spinal cord group, and a lot of guys are saying that their GPs don't support them, and then there's reasons around that, being scrutiny amongst the profession, some people looking down upon them as someone who's supplying that to somebody in very conservative mind frames. But what about the doctors that are charging people to sign off on that? Is that's kind of a gray zone too? There have been, the thing with that is, if they do it according to their professional duties, the doctors who are signing it, they're not in a gray zone. Like, they can do that. But what happened is, there's a couple people. There was like a notorious one out in Camerman's. His name was Dr. Camerman's in Ontario. I think he signed 2,000 of the forms, and he was charging I think even $2,000. Which was ridiculous, and he wasn't, apparently, well, he's under investigation, but they're alleging that he wasn't actually doing a proper assessment of the patients. And we saw this kind of spike in the stats from Health Canada. Originally there weren't that many people signing up, and then these doctors got in the business, and there was a spike of people signing up. And it was funny because the biggest condition that there was a spike in was arthritis. And we were like, that's weird. How did that happen? And we're assuming that this doctor just checked off arthritis for everybody. I don't know. So, there are people who have been abusing it. The program, the Health Canada's program, has been abused tremendously. It wasn't on both ends. I would say on Health Canada's end, they did not create a program that met the constitutional rights of patients, and they needed to do that. They were ordered to do that by the court. They didn't want to do it, and they didn't do it. And I think that that's problematic, that they're unconstitutional. But they created a program, and because of the larger milieu of prohibition, and because it doesn't work for patients, it's being taken advantage of. And that's the world we live in. That's people do that, and there's people do that everywhere. There's business people and opportunists in every field and everywhere, and it's not, cannabis is not exempt. And there were people who, because the sources for cannabis, the legal sources, were grow it yourself, get somebody to grow it for you, or buy it from Health Canada. So we've talked about the option of buying it from Health Canada's sole supplier, Prairie Plant Systems, or PPS. Poor quality, one strain. Very few people are doing it. It's the only medicine that comes with a return form. So it's been bad. Apparently their hands were tied by Health Canada. Health Canada didn't let them produce more than one strain, all that kind of thing. But nonetheless, that's what's available. People, again, it's not like everybody can grow their own medicine, and that's a lot to ask. And then people have been, getting people to grow it for them, but there's also been a bit of a business in that world where there's people who are like, give me your license, designate me to grow for you, then I'll be protected by the law. I'll grow more, and then go to a doctor and get them to give you 20 grams a day, and so I'll be covered to grow that much. I'll sell you or give you, or the amount you need, and the rest I'll sell and make a profit for. So people are trying to find ways, they're using it to be covered. So there have been abuses, no doubt. It's a widely abused program, and I would say some of the doctors are part of that too. So there are some large amounts that are being given to clients or patients that are asking for upwards of 60 plants.
Well, yeah, patients, that's where doctors, I've talked to a lot of doctors, and I've helped some doctors who are going into this business, actually, because, I want them to do it ethically, so I'm willing to give them advice on how to do it ethically. But, their questions have been like, how do I know that these patients aren't pulling the wool over my eyes? A patient's coming in and asking me for 10 grams a day. Are they really needing 10 grams a day? And it's like, well, some people might validly need that much, and some people don't. There's a kind of a Health Canada stats say that people who are growing for themselves are averaging, or buying it from Health Canada, are averaging about 3.5 grams a day. And people who are getting someone to grow it for them are averaging 9 grams a day or 10 grams a day. So that's interesting. And maybe, maybe people really need it and they just can't grow that much on their own. It's very hard to say what's going on. But I know just from my experience that there are people who have been paying patients to sign them up as a designated grower so that they can legally be growing. So anything's going to be abused, any system you create.
and two as well, if people are getting large amounts, there are cases out there where people are sharing it with other people that maybe don't have the wherewithal to go through the process, right? So they're sharing it amongst their community.
Exactly.
And giving away medicine to people that need it, that aren't signing up.
That's right, because if one person has to go and sign get a doctor to sign their forms for, let's say, $1,000 or $500 or $250, maybe just one person can do that, and then they can share it amongst their community of friends who are also patients. It's inaccessible, and it's there's a lot of problems, and we're like in terms of the cost as well, it's very expensive. I wanted to go to the next slide, and I don't know how to do that. Oh, here we go. But we're going to talk a little bit more about the landscape, and then we will get into the new program, so we can talk more about how that might change. So I guess just around dispensaries, there's about 50 across the country serving over 30,000 patients. And that's kind of the study I was telling you about, where about 50% of people who report using cannabis for medicine are getting it from a dispensary versus through Health Canada's program. And although it says 65%, we just redid the numbers before I came, and it was 75% of people authorized are buying it from a dispensary. And even more so than the people who aren't authorized, which I found really interesting, because dispensaries don't require their patients to have a Health Canada authorization, although they'll help them get them if they want it. So the next slide's a visual. This just shows you the difference between, the top one on the left is the Vancouver Island Compassion Society and theirs, and then looking at Health Canada's, and then a kind of close-up of Health Canada's with their stem. Apparently it's getting better, but it's still one strain.
And it's probably stockpiled, so it's not going to be fresh. That doesn't look that fresh.
I know. There's an interesting thing right now where they're kind of trying, with their new program, which we'll talk a little bit about more, they want it to start into to sell everything, and some people are laughing and saying, we're not going to store it for a year. That's not how you do this. But I guess, there's been a lot of changes because of the courts. I don't really even need to get into it because the program is changing, so I'm not really going to get into that so much. So dispensaries, you were asking about kind of how people get this information. So what they do with people is they check their documentation to make sure they have a confirmation of diagnosis. Some of them also require a recommendation for use, and some say as long as you have a condition for which there's ample evidence, that's ample. And they make sure that it's valid. And again, this has to be meticulous. The doors have stayed open at these dispensaries for over 15 years now, and you have to be meticulous. So check that the doctor's actually in good standing, and that it's really coming from the doctor. And then they'll do an intake session where they'll do all this kind of education on the safe and effective use and what strains and products to use. And they'll come up with a plan for the person, like based on their conditions and symptoms, what's the best for you, and some kind of, if they need any extra support or monitoring, depending on what condition or symptoms they have. It's interesting because some patients come in and they've never used cannabis before, and they might need more information. And some people who've been using it all their lives actually have never really used it as a medicine, and there's a lot they don't know. They come in going, I know everything, and then they go through the kind of talk with the staff, and they're like, oh, I actually didn't know that. So there's just, different things. Like there's a myth going around in the recreational world also that you have to hold it in as long as you can. And, and people start coughing. You don't have to do that. It doesn't give you any extra bonus, anything. It might kill some brain cells, but, for lack of oxygen. But so there's just things that people learn even though they've been using it a long time. I guess the having on-site access, which dispensaries have, they also do mail-outs. There's, for people living across the country up north in rural communities where there isn't a dispensary, a lot of the dispensaries will mail it out for them. But it can be very nice to have the kind of face-to-face support, or even if it's being mailed out, there's still somebody you can always call and talk to. So there's a lot of personalized, I didn't mean to go back there, personalized services and individualized support, and also a sense of community and connection. So that's something that can be very helpful for people using a medicine that's a little bit stigmatized still, that not everybody uses. Maybe they're getting flack from their friends or communities. Maybe they can't use it where they live. Maybe they live in subsidized housing or special housing where they can't use it. Some dispensaries might have a place, a lounge where they can use it with vaporizers. But even just being able to go in and be with other people who are using the same medicine can be a really good sense of community and connection for patients. A lot of them, who are living with chronic and critical illnesses are isolated. So it's a bonus that patients have talked about.
That's what happens with spinal cord injury. It is used for a lot of secondary issues that cause people to be in isolation.
Right.
And it does build a sense of community among certain groups, right? One of the things too is that a lot of people that do have spinal cord injuries are living at a poverty line and just off disability benefits. So access to something like a vaporizer, we have quadriplegics or tetraplegics have limited lung capacity. So being able to smoke through like a pipe or a joint can be quite harsh for some people, and it can affect their lung capacity, might even be on a ventilator.
Yeah.
So there's having different ways to do it. But what about the cost of like a vaporizers? Are they subsidized? Is there any way of...
Right now, what happens is through the dispensary, some of them get reduced costs because the suppliers will make an allowance for, they'll do that. They'll kind of source out a supplier and say, this is for medical patients, and they'll get a lower price that they can pass on to their patients. Or they can, they've made some arrangements with the local stores that sell them to say, if somebody has a card from this dispensary, give them a reduced price. Health Canada has said that those devices can be used as a medical expense on your tax forms. So that's good to know.
Very good to know.
Yeah, and it would be nice to see the full costs covered for sure, but the tax thing is good. Another thing that dispensaries have is some of them have access to other natural healthcare therapies, which is very helpful because they can be very expensive and inaccessible. Massage, Reiki, acupuncture, nutritional counseling, holistic counseling. The BC Compassion Club Society has a wellness center, and they use any, profits from the sale of cannabis to subsidize access to these different healthcare services. And some of them also do advocacy, which is very important, in terms of people, let's say, who are living in subsidized houses or special housing, or, who need help talking to their healthcare providers or have legal issues. They can either help refer them to somebody or actually work with them to give information that can help them. And a lot of them are also involved in research, which is very important because all of these
I'm just curious, do the dispensaries, do they also provide edible products? Or all of them or some of them? I'm curious about that, and just that's an option for people with problems with their lung capacity.
It is. It's very helpful to have that. It is up to individual dispensaries at this point, and that actually leads nicely into what I want to talk about next, but it is up to individual dispensaries what they have. A lot of them will have this because they recognize that that's really vital for a lot of patients. You know, they need to have the edibles or the tinctures or the topicals or different forms of use. So that's really an important part of dispensaries. That is something that Health Canada isn't providing in any way, that dispensaries do provide. Yeah.
Some dispensaries are quite creative. They have good people that are working there and making things like beyond like butters and oils,
butters and oils, so you
oils.
can cook yourself with it, or wheat-free and sugar-free, and salad dressings, popsicles, lollipops, exactly, candies, things like that. So there's different ways, but a lot of people like that, just getting the butter infused so that they can use it themselves in their own cooking or what have you. And so it's a good question that you asked, because all these dispensaries, I mean, really, people can just open it up if they're willing to take that risk being in the gray zone. And it is a risk if you're not meticulous. So there are sting operations that happen. So if you're not being meticulous, you will be shut down. If you're doing anything sketchy, you're going to be shut down. So, and people do that, and it gives a bad name to everybody else, which is really unfortunate, because it's like a medical cannabis dispensary is like running a healthcare center and being illegal. And that's really challenging. So it's enough to just have a healthcare center, let alone dealing with the kind of perceptions and the stigma and the legalities. But what's been happening is some of the dispensaries, wanted to promote dispensaries running well, so that, one, for patients, so that patients could get good service, and also so that it didn't bring everybody else down. And a few years back, I co-authored guidelines for the distribution of medical cannabis in Canada, with Philippe Lucas, who was working at the Victoria Compassion Club. And a lot of dispensaries, they all use it. Like it's a nice roadmap if you're starting a business. It kind of tells you all the things you need to kind of have. And it's been used internationally. I went to Israel and they were using it there. I couldn't believe it. They're like, look, I was like, I wrote that. But what we did is, we were talking to Health Canada, because we've been trying to promote this model. We've been saying, include this, like the courts have told you to do that, we're telling you to do this, include this in the legal framework. This is really helping patients. They can't they're not going to get these services by mailing them a package. This is important, and having one strain and all the different products. And so they had kind of come back and said, well, the model you present to us, that looks really great, but how do we know that anybody who just opens up a shop and puts up a shingle saying Compassion Club or dispensary, how do we know how they're running? Like, we don't. So one of the things that we did, it was kind of, a vision and clearly needed, was to create an association of medical cannabis dispensaries called the Canadian Association of Medical Cannabis Dispensaries that we opened up a couple years ago. And this was meant to kind of help unite all the dispensaries so that they could work on their common issues together. And a big part of that was to create standards and a certification program. So most healthcare organizations are certified by Accreditation Canada or other accreditation bodies. So we're creating an accreditation program. And it seems to be, we've had stakeholder consultations around it. We're trying to really address everybody's concerns and get buy-in for it to get more credibility. And really it's about patient care, having excellence in patient care, and also increasing the credibility of dispensaries in the larger community, because it is a stigmatized medicine. And one of the great things about it was we got a grant from the Peter Wall Solutions Initiative out at UBC. There's a foundation there, and they supported this project. It was called the Solutions Initiative, and they wanted to not just fund like researching problems, but what's the solution, and they agreed that certifying dispensaries would really help access, and they have funded a 3-year project that's helping to develop the certification program but also evaluate it. And that brings a lot of credibility, just getting that. So the new regulations, which we'll get into the kind of the nitty gritty. So they did a stakeholders, they went across the country, they kind of put out a little, like, we're going to change the regulations, here's some things we're thinking about, and they went across and did stakeholder consultations. They didn't meet with patients, they allowed patients to send in emails, and then they actually met with dispensaries for the first time as official stakeholders, which was quite a novel thing after all these years. We've been kind of sending them reports and chiefs, and came out with new regulations that have now been published in the Gazette 1, which is kind of the first step to new regulations. And there's a 30-day period to respond, which ends on February 28th. So next week is the last day for responses. And so the key changes are there's no more category 1 and 2. There's no more categories. You just go to your doctor, get them to fill out your form, which still is going to ask them for a kind of grams per day. And there's no more sending it back to Health Canada. There were a lot of delays through their bureaucracy before, months and months and months of delays after you got your doctor to sign it. They're not going to be in the picture anymore. They've decentralized it. It's between a patient and their doctor. Get your doctor to sign it, and then that's your kind of ticket. They've expanded the healthcare practitioners that can sign, and we that was some advice that we gave them as well, and the dispensaries do that. The dispensaries allow nurse practitioners, doctors of traditional Chinese medicine, and naturopaths, and Health Canada was only allowing physicians before, and now they said we're thinking of extending it to nurse practitioners in the provinces where they're allowed to prescribe narcotics, which is starting to happen. And they would have to still get special permission from their own associations and colleges to do that. It's not, the government can't tell them what to do, but they can allow them to do it if they want to do it. So they're kind of proposing that they allow nurse practitioners to also be allowed to sign these forms. Nurse practitioners historically have been very favorable of medical cannabis, so this would be great. They've been a lot more open-minded about it than the physician associations.
Well, a lot, the Nurses Association, or people that are working within it, are working hands-on with the patients and know what their needs are and the effects, the benefits that they get from it daily.
Yeah, and they don't have, the kind of the extremely conservative regulatory bodies, that the physicians kind of work under. So there's no licensing from Health Canada. A big thing, though, is that they're removing these personal production licenses and the designated production licenses. This is huge for a lot of patients. Not that all of them are using this part of the regulations, but for the ones that are, this has been, especially the personal production licenses, really help keep the cost down. Cost is really important. People are living on limited incomes, and growing it themselves there was an analysis, again, the CBA final report document that's attached there. There was analysis commissioned by Health Canada, and people who are growing it themselves were able to grow it, I think it was for something like, $1.60 a gram, something very low. People who were buying it from, or had designated growers, it was depending how much the grower was profiting off of it, but the grower could, without any overhead or profit, grow it for, I think they were saying something like about the same amount, $1.50 a gram, but with the overhead and any profit that they were adding on, it was about $4 a gram. Health Canada was selling their product for $5 a gram. And they are estimating that they're getting rid of designated and licenses and personal production licenses, and they're adding in a new category of licensed producers. And these are like commercial producers. And they're estimating that the cost on the commercial producers is going to be about $7.50 a gram. A lot higher. And by their own estimates, in their own analysis of the regulations, there's this kind of little report at the beginning, regulatory impact analysis or statement. They say that 15% and also in their CBA report, their cost benefit analysis, about 16%, 15, I'm just going to say 15 because one's 15 and one's 16, I don't know which one, but about 15% of people are going to be costed out. They're not going to be able to afford their medicine. And to them, that's acceptable somehow. That 15% of people just won't be able to afford the legal route. And then they say that 15% are just going to opt out because they're currently maybe growing their own and they're going to want to continue growing their own. They're not going to want to buy from one of these licensed producers. I mean, there's no guarantee that the licensed producers are going to grow a strain that you like. Nobody knows how that's going to go. Nobody really, this is very theoretical. Like what they've done hasn't been tested. So they're kind of throwing out this idea of, hey, this is going to work, and nobody really knows if it is going to.
And how is it going to be grown? Is it going to be using chemicals and things that people...
They're going to have like some of the, basic standards for production, like that you would use for agricultural production. So they're going to have basic standards, but yes, chemicals they're not requiring, and I think that's a really important point, but they're not requiring organic cultivation. They're not, right now the way Health Canada's contracted supplier was growing, they weren't doing it organic. They're doing, this large-scale operation, and then at the end they were using an irradiation process, and that's never been tested for the effects on smoking. Maybe that's okay for eating, maybe, but people, a lot of people really don't want to be inhaling or ingesting the chemicals. So there's two things that are kind of really problematic with that. It's just that the costing out, that people aren't going, like that they know already, they're anticipating that 15% of people won't be able to afford it, and that people just aren't going to want to do it. So that's what they're proposing. So
it sounds like it'd be questionable if it would be an improvement on what Health Canada is able to produce now, less quality, same strains.
Well, what they are,
an improvement by having licensed producers.
Yeah, I mean, it can be in terms of now they're not limiting it to one strain. So they finally, after 10 years or more of us telling them there need to be multiple strains, now they're saying there can be multiple strains. So there will be multiple strains. So basically they're envisioning something where the patient would get their script from their doctor and send it to these commercial producers. And they could send it to more than one. They'd have to get different scripts for different producers. So they could shop around. I think they're envisioning it a bit of a market in that way. Again, doctors, the problem with this is they're still having doctors as the gatekeepers, and they have clearly said they do not want to be the gatekeepers of this program. So maybe there'll be access to quality in terms of these licensed producers instead of the one licensed producer they had. But they also are taking away people's personal production, which maybe people had found the perfect strains for themselves. So some of the things that we've been looking at is proposing that they allow with any authorization for a patient to grow up to 10 plants or 6 plants, which is something that's done in the States. There's 18 states that have medical cannabis legislation, and some of them, probably about half of them, have that kind of system in place. So if you get your license, if you get your authorization, you can automatically grow a small number of plants, which does address the safety concerns. So what they did with the new regulations was really erring on the side of erring on addressing the concerns around safety. The fire inspectors and the police kind of said, there's rife abuse of the system, and I'm not disagreeing with that, but they also were concerned that, there could be fire hazards. There's not any proof that there's been, increased fire hazards from, authorized productions, but what they also, I think, would feel more comfortable with is, and I don't know why it isn't in there, and it could be, somebody to do it, that they would have to have a electrical safety inspection, and that would address the fire concerns. But they're not right now, so people aren't getting it. I think there was one of the studies we did called CAMPS, Cannabis Access for Medical Purposes survey, but it looked like I think it was a small number, like 7% were doing it, even though they weren't compelled to. But if they were compelled to, then everybody would, and that would really address the safety concerns around production, personal production, and would really help with costs. The other thing that we're really advocating for, and is vital, is that the costs are covered for patients wherever they buy it from. Whether they get it from these licensed producers or, from dispensaries, but that the cost will be covered. And this is a medicine that's used as a substitute or alongside other pharmaceutical drugs, and it really needs to be covered by our healthcare system. So we're really trying to work with the provinces to find ways to cover the costs.
A couple of questions that have come up in the chat session here are referring directly to people who, if this regulation, first of all, these regulations haven't gone through yet.
No.
So these are proposed regulations?
Yeah, so I'll tell you just the state of that. So it's in the Gazette 1, There's input until February 28th, assuming they don't change it, which is likely. That if there's minor changes, they're expecting if there's minor changes that it'll go through to the Gazette 2, which then becomes law and will be implemented in the spring of 2014. So the beginning of April 2014 or March 2014. It would become in effect. So what they're saying is they're going to stop giving the year licenses for personal production. There'll be one more set of them, now, and they're going to start phasing them out.
So then this comes to the other question that was asked is, people who had been signed up ahead of time, would they be grandfathered through so they're allowed to keep that right?
They haven't said that, and so that's another thing that's being added, some of the patient advocates are advocating for, is for them to be grandfathered, but no, that's not part of what they're proposing. So this is why it actually is really important for people to give their input. It's important to know about it, to get, know all the details, and to send in, there's a website there for Health Canada Medical Marijuana. It's the fourth one down. There's probably a link to there, and also the proposed marijuana, the last one, proposed marijuana for medical purposes regulations. That's the Gazette one, and between those two web pages, there'll be instructions of where to send in your responses before February 28th. But yes,
so it's necessary. I mean, it's good that we're getting this word out.
And really, like as an organization, it would be very good. Like I'm trying to, the Canadian AIDS Society is sending in a submission. The BC Civil Liberties is sending in a submission. We're trying to get the Canadian Association of Medical Cannabis Dispensaries is sending in a submission. So it's good for, I think, individuals and also organizations to express what they would like to see, because this is kind of the time where they can make amendments. Now, what will happen if they don't is we'll be stuck with this, and there'll be court cases, and it'll be unclear, and then it's going to be however many more years until we get, either amendments or a whole new set of regulations. Up until now, it's just been amendments, and this is actually a new set of regulations. So we'll be stuck with these regulations if they don't make substantial, amendments, and then we're going to be in court, and kind of patients are still going to be struggling with costs and access.
Rielle, you have no other products? Does that mean no tinctures, no edibles? New licensed producers?
No, I mean it's the same as before, but like they're expanding the amount of strains that can be grown, but I guess they're not allowing the kind of these licensed producers to sell tinctures or bakers. But if you recommend it, they might, if they hear it from enough people, they might add that in.
There was just a couple of weeks ago a news item of a certain gold medal winning snowboarding guy that lives in Whistler who's going to become very involved in dispensary. Starting a dispensary, like a very upper class, sort of high quality dispensary, and it sounded like he was really going to be involved with all of these new regulations. They talked about that.
I'm really skeptical. I mean, I kind of was just a little bit like that when I was reading what he wrote. He's not well informed at all. And I don't really think he knows what he's talking about, frankly. I think that he could have access to people who did, and he could do a bit more research before he starts talking about things.
Celebrity to sort of promote the cause.
He did a very poor job, and I don't feel like he's done his due diligence or research and knows what he's talking about. The regulations do not allow for storefront dispensaries, and what he's proposing isn't going to help that cause at all, because we've been putting in a lot of decade plus of knowing that there's I'm just going to go to the next slide. So there was a petition that patients put out, and they were around the new regulations, and they were saying the new program isn't accessible, or the program hasn't been accessible, and that the dispensaries give them all of these advantages: education, one-on-one consultations, strain diversity, other options for non-smoking, a supportive environment, community resources, and that they really want to see dispensaries be legal suppliers. And there's really no reason why they're not. They could be regulated just the same way licensed producers are. But what in our talks with Health Canada, in a way there might be room in the regulations, but it's up to the provinces. That end of it is up to the provinces. So we're starting to move to talking to, looking at things more on the provincial level, because Health Canada is kind of dealing with the supply side of it and saying this is how we're going to kind of work around the current illegal status or prohibited status of a controlled substance to allow for medical use, but the actual health services are in the purview of the provinces. And what they've kind of been saying since day one is, why don't we have pharmacies distribute it? And pharmacies have not taken this up as of yet, for maybe the same reasons that the physicians aren't taking it up. So they haven't taken it up. It would be nice to see some pharmacies do this, because there aren't dispensaries everywhere, and it would be having all the different strains and a fridge with cookies and tinctures. I don't see that, and I don't see them giving the hour to hour and a half intake sessions with patients and being able to, talk to people in the same way. I do think that dispensaries are kind of already specialized pharmacies, and it would be nice to see the provinces kind of work with that to establish maybe a category of specialized pharmacies for medical cannabis. But also, it'd be great if the pharmacies also decided to take it up, because it's more accessible for patients.
So do you think that dispensaries, that this could be saved if there was a bit of an uprising, or people that are actually consumers and patients that are growing were to become very vocal?
Yeah, I do. I mean,
as a mass, and not just individually, where you get one person who steps up, but.
Yeah, I do. I mean, I think that I think at the in the regulations at the federal level, they can make it a little bit more explicit. But I think at the provincial level, that's kind of where it's going to be needed. But yeah, I do think so. I mean, like this petition, I think there was about 2,000. I keep using that number, but patients, 2,000 or 3,000 who signed it, and it was given to Health Canada. When I read the regulations, though, what they have in there that isn't good is they make it clear that they don't want on-site distribution. And to me, that's ridiculous. Like they only want mail-outs. They only want couriers or mail to patients. And I don't see how patients are going to get the kind of care that they need through a package that comes in the mail. There's also something that was pointed out by somebody who's kind of in the production side of things. But right now, so with Health Canada's sole supplier, they've kind of had the gravy train for about 10 years, where the markets have been huge. They've been 1,500%. Even though it's only $5 a gram, there's a 1,500% markup. When you have the economies of scale, and also everything that they're doing, they didn't really have overhead. The government was subsidizing everything, the equipment, the facilities. They were buying them, the equipment, and then renting it from them. They were paying them. There's a report on one of the, if you look on the Canadians for Safe Access website, they were paying this company $50,000 a month for monthly reports. They were doing very well. It didn't need to even be that expensive. But one of the things that was helpful about the subsidizing for patients was that what was also being subsidized were the mail-out costs. So when you courier or send it in that way safely by bonded courier, it's about $35 to $40 per package. Patients weren't paying that before. And with these new licensed producers, that's going to be an additional cost for patients. So they're going to be paying the $7.50 a gram plus the shipping cost. So that's something that patients should be aware of, that this new program it's not considering the cost to patients. And in fact, it is considering and saying that's okay that patients are costed out. Maybe it's a better system in terms of having licensed producers more than one, not having a monopoly supplier that the government's subsidizing. But I think what this might be a really big call for is cost, like advocating at the provincial level for cost coverage. And I do think that patients en masse coming together and doing that would have a big effect. And there's, maybe some research that needs to be done. A colleague of mine has been doing some research around the substitution of cannabis, how cannabis is being used instead of opiates, and wants to look at the, like a cost-benefit analysis of that. Like, people who aren't using opiates, how much is that costing the healthcare, saving the healthcare system? Or people who are using cannabis and not having to use other services, healthcare services, looking at how much it's saving, because it might come down to an economic issue. But I think that it's kind of a call for it. The new regulations that Health Canada is coming out with saying, look, the price is going to go up this much and it's going to cost out at least 15% of patients, is a call for patients to stand up and rally for access to medicine that they can afford.
Just to lose that one-on-one consultation process too, that's huge.
Well, the thing is that the dispensaries were never part of the regulation. So they've always been operating this legal gray zone outside of the legal framework. They might continue to do that. I mean, just because these new regulations also don't include, or still don't include, dispensaries, it doesn't mean that dispensaries still aren't going to keep their doors open. If they feel that they can justify in court, which they have been doing up until now, if they feel that they can justify in court keeping their doors open and willing, because they're engaged in civil disobedience, they're risking, their liberties. So if they feel that they can still do that like edibles and tinctures, because they don't have the one-on-one consultations, because of all these things. And a lot of the dispensaries will have cost considerations for lower income patients. They'll do what they can. Maybe their grams are still $5 to $10. They'll range from $5 to $10, but some of them will have a weekly amount that they donate or give at a $3 a gram for patients who are in need. They try their best, but cost is an issue, even from the dispensaries. But they're not necessarily going to shut their doors because of these new regulations if they feel that they're still providing a service that the government isn't. What has come down the line that could also impact, though, this kind of the risk that dispensaries are taking is, on a larger level, there's mandatory minimum sentences now that have come down through the crime bill, the Harper's crime bill, and that's in effect. And so before, where the dispensaries and their producers were getting conditional and absolute discharges, that's not going to be an option anymore. So because of the mandatory minimum sentences, if it's over 3 kilograms, these mandatory minimums start coming into play. And they also did something where they increased the maximum, and apparently that's also related to if you can get a conditional absolute discharge. They've increased maximums to 14 years, and somehow that has kind of effectively ended that absolute particular strains for patients at often a very much reduced cost in the black market are not going to want to take those risks anymore.
A drunk driver killing someone will get less than a third of that sentence.
Yeah.
It just seems not a very level playing field.
It's not a level playing field. No. So that's kind of, what I got for you. And then I'm happy to look at the chat and the questions and my emails there as well if you want to. I'll just go through a little bit of the links of lobbying and the certification program, which has started. 3 dispensaries have now started the certification program, so that's exciting. Canadians for Safe Access is an advocacy and research group for patients. It's Canada's first advocacy group for medical cannabis patients. The Canadian Consortium for the Investigation of Cannabinoids, really good science and research on there. That's like a very good go-to site if you're looking for the research. And then there's 2 sites for Health Canada for their program and the new regulations. I can't at all see the chat box from here.
Chat box in there. A lot of the questions I alluded to. There was one from Dwight asking why they're not, the government doesn't regulate the licenses that are giving out.
Right. Like in terms of why they don't do inspections.
Yeah, like that's
Yeah,
what it is.
they should. So they created a program, and it failed because they didn't implement it properly. Why? I can't answer why. I don't know. They didn't want it to work. They didn't know how. They didn't have the resources. For whatever reason, they've had a long time to make it work. They've had 10 years. So the first question we had asked was, do you currently use cannabis for medical purposes? So of the people who are on, I can't see what the number is. It's 50-50. We've got a couple other questions we can put up too.
Pat's asking a question.
Yeah.
If you know if it's worth applying for authorization to conduct certain research and development activities with marijuana at this time, or is it a waste of time?
I don't think it's a waste of time. It depends what your intentions are. I mean, I think Health Canada put that in because they want to make sure they have a very ambitious timeline of ending these designated production and, personal production, and then having all the current, 25,000 patients being able to access a good supply by March or by 2014. So I think they're encouraging people who they think will apply for these to be licensed producers to get on it now. And so I think it's a great opportunity if you want to, if you're interested. But I don't know what the stipulations are going to be and how if there's going to that's something to look at. Like I don't know that they're just going to give it to anybody. You probably have to have your $1 million facility. I don't want to discourage anybody, but and all the security systems in place. Maybe you won't need that for the research and development, but I highly think you will. And definitely for the new licensed producers, there's a lot of not everybody. It's not going to be something that just anybody can do. You're going to need. Then there are people who are getting together who think that they're going to go for those licenses. But they need to get on it, and raise a lot of money and get investors and pull it together.
I think
It's
there's
business.
a lot of people that do have their licenses are quite quiet about it, and to vocalize or to step up and stand up and start fighting for, to fight against some of these new regulations draws more attention to them from their community as well.
Right.
I think there's a bit of a balancing act going on there. And,
Yeah, it's private. It's your
It's very
health. It's
private.
private. It should be private. There is today, I think, actually, there is some patient groups that were doing some protests across the country, that were organizing some protests against the new regulations across the country. But it's true, not every patient wants to be vocal, but, it's kind of, I don't know if you have to get out there and be in front of the cameras. Maybe it's a matter of writing a letter to your MP or, responding to these regulations. But I understand it's a privacy issue. Most people don't have to be very public about the medicines they're using.
So would you recommend people in communities around BC who could they write to? I mean, I know you.
I would write to your MP. I would write to your MLA, definitely, and to the ministers of health in the province. Even to your local city government as well. There's some of the municipalities are starting. I mean, the thing is with these new licensed producers, it's kind of coming into the provinces and the municipalities now, because where are they going to be growing? Now they're going to be in communities. They're going to be growing. So every municipality is really going to have to come out with their own regulations of zoning and anything else. If people are producing for themselves and they want to keep that right, some of the things to talk about are, rather right thing, but they can say, we'd be willing to get a certificate, an electrical inspection, and we'd be, we don't want our rights to grow taken away. Please allow there to be a 10 plant or 12 plant, or 6 plant, whatever amount, automatically that patients can grow. I was talking with some people who had the concerns around the fire codes and safety, and the lower plants numbers might meet those concerns and the electrical inspection. So it's kind of, I still think there's hope. It's just like we weren't all at the table at the right time. There was Health Canada at the beginning had a stakeholders advisory committee and had different stakeholders there to talk about all these things, and then they disbanded it. So we've really, unfortunately, not been talking to each other to figure out the solutions. But we're starting to do that outside of the system, but this is the time.
These new proposed regulations be based. I'm just wondering about what the business model or the model for the regulations look like in California and Washington, if they're a workable model, if that's a workable model, or if there's been any connection with any of those.
Yeah, I mean that's exactly. I mean, there are some models out there that are regulated, so that's something to look at. And then with the association here creating their certification program, that could also be endorsed. They can give input to make sure that they feel comfortable with the kind of regulations or standards that are being put into place, and they can endorse it. And we can create our own, or we can look at what other states are doing.
It seems like they've taken a pretty big step in it's not legalized or it's off the controlled substance list, or it's a pretty big step.
In Washington and Colorado.
Washington,
yeah.
And is it Colorado
Yeah.
and California too, isn't it?
They haven't legalized yet. Yeah. But Washington and Colorado, yeah. It is a big step. Yeah. So it's interesting because everybody's dealing with it now. It's out there and everyone's dealing with it, and they're trying to balance, is this about taxing and regulating? Is this about jobs? Is this safety concerns? And
well, it seems to be going that way. That it's looking more and more like the government is realizing there's a lot of money to be made, and this could be just the stepping stone towards it by starting some of these regulations and them taking control back. Because if there is only 25,000 people, as you say, that are signed up legally, why is it such an issue then? If, they know the stats of the larger numbers of people that are using them medicinally, but very small percentage of that are actually signed up legally, right?
yeah, and that's so they're thinking they're not really addressing that in their regulations. I mean, I guess they're addressing it by saying we'll add nurse practitioners, and we'll see which provinces that can happen in, and if the nurse practitioners take it up, hopefully they will. I think there'll be, that could help with signing more people up. Physicians, maybe need more education on it, and maybe if there's more education and support from their authorities, they would sign up. But yeah, 25,000 isn't a lot. They do in their they estimate, they're kind of going on that kind of 400,000 to 500,000 number, and they estimate that many people will sign up at some point. But again, they haven't taken into consideration the privacy issues, and that if those barriers to access in terms of physicians and other healthcare providers signing the forms aren't taken care of, the numbers are still going to be pretty small.
Unless, of course, they do say something about grandfathering, and then they'll have a mass sign up in the next year before April 2014.
That's true. That's true. Yeah, everybody's I want my license to produce. Yeah. Maybe that's exactly why they haven't done that.
And then some of those doctors will be making a lot extra money.
Yeah.
Lineups at the door.
Yeah. So I mean, it's a difficult one because you're looking at there's this context of prohibition of cannabis, and really within that, and you're trying to eke out room for medical use within that, without really admitting, Health Canada and all their statements, they won't quite. They even have little kind of qualifiers saying, but we don't really know that it's a medicine. It's not really proven yet. So how are you going to really create a good system if you don't even believe in what you're doing? And, how can you, really address the concerns of the patients when you're really at the same, really addressing the concerns of prohibition? They seem to not kind of be complementary, and then you're erring on one side or the other. And, I do think that the courts have told them they have to do something, and they're doing something. So this is the latest thing they're trying to do. This is kind of their latest kind of conceptualization. And I think it speaks a bit to the current government that we have going on, making these private enterprises as the, potential solution. I think that's, kind of just in line with that kind of thinking, and it might be a good business, but it bothers me to see it all come down to business when, healthcare really that's not the Canadian way of healthcare. It's not supposed to be about for-profit and business. So that's kind of what they're doing. So they're kind of throwing this herbal cannabis. They're saying, really, it should be up to the same standards as pharmaceutical medicine when it's not a pharmaceutical medicine. And, we're going to put it into, private land instead of healthcare, not-profit, universal land. So they're just messing with it, really. So what do we got there? Do you have an authorization from Health Canada? So of the people that answered, everybody does.
Only one person.
Only one person did, or two.
Answer the polls, people. We're running out of time.
Are there any more chat comments that I can't read?
There's been a lot of comments, which has been really great.
I wish I could have seen them while I was, but I can't.
You're going through. Well, we'll have access to that.
Yeah.
And check some of those out.
Yeah.
All right. Well, thanks a lot, Rielle.
You're welcome.
It's been great having you.
Yeah, I hope that answered some questions and gave some valuable information. And please check out the other websites and links, and feel free to email as well.
Speak up.
And speak up.
Speak up to the government.
Oh, and speak up to the government. Yeah, the February 28th deadline, and organize. Again, you can look at if one of the associations wants to look at some previous, or some other people's submissions. There's on the CAMC, the Canadian Association of Medical Cannabis Dispensaries. You can see kind of our previous submissions. And when we submit our final one, which probably won't be until the last minute, but you can see that one as well. But if you want templates, I think the Canadian AIDS Society also has a template of one that they've sent in before, and the BC Civil Liberties Association. So, you can start from what's already been done, but I'd say organizing is really important.
So there are petitions out there?
It's submissions.
So there's no petition now that people, to get something going on Facebook or through social media.
There is a group, like there's a patients group that I know has been doing some organizing, and I don't have their name, but I can send it to you.
That would be great, because we can pass it on.
Would something like that on Facebook, like if you were to start a group on Facebook, could that be considered a petition, or is that just...
Not really. It's a tool. I think it's a really good tool for organizing if you want to organize a petition. But I think there already is a patients group. But again, like if you want to sometimes it can be helpful to join patients group that already exists, and also start, new ones that maybe are specific to certain things, like for spinal cord injury patients. It could be another voice, right? So it's like, there's MS patients, and there's...
Perhaps provide links to petitions, online petitions.
Yeah, and even just writing letters, just saying, I want to make sure that the costs are covered, that's really important.
Someone would like to know if you could put the link. They couldn't find the link that to the feedback where you put the feedback before the February 28th
They were
deadline?
one of the last. It's probably the last one. The proposed marijuana for medical purposes regulations that's the Gazette one, and there should be instructions there how to respond. Is what I'm thinking. But if not, I can send it in somehow to you guys, and you can put it up maybe.
We will for sure. We'll actually post these links.
Oh, great.
Same person asked a couple times about abuse hotline to report people who are abusing the system. I've seen that on there come up a couple. Is there one?
No. Not that I know of anyway. No. Well, and it's such a hard one too. It's such a hard one, like where, we're talking to, for example, to some doctors about it, and they're just saying, oh, it's not really medical use. Like some of the colleges and physicians, they say it's not a medicine, and they say it's really all recreational, and they actually say that recreational use should be legalized, that it's not harmful. It's like drinking a glass of wine. They just are like, this isn't medical, don't bring doctors into this. And, they have this thing saying, just because it makes people feel better. And, they'll give an example, like they don't trust the young man who comes in pain. And it's like, why don't you trust the young, maybe he was a construction worker and has some, some disc injuries. And, they just, there's just this feeling of everybody's just using it as an excuse to get access to recreational drugs. And I think that if they spent any amount of time with patients at dispensaries, they would really see things differently, because it's not what's going on. Like, people really are getting benefit from it. And, some interesting conversations around it where they're saying, well, just because it makes people feel better, it's like, that's why people take medicines. All the prescription drugs are about insomnia and anxiety and depression. Like, you're prescribing drugs for these things. And here's a medicine that can help people, let's say, with their pain, and also give them a better quality of life, improve their sense of well-being. That's not a bad thing. But I think, again, because of the stigma of the years and years of prohibition, that is just something that patients are really having to overcome. And so are healthcare providers in themselves having to overcome that stigma. But, so it's hard to know the abuse situation. And again, in this kind of context of prohibition, it's a tricky one.
It is, really. And I mean, within the spinal cord injury, and we already population, we've discussed this, it's used for secondary issues mostly, and probably most used for spasticity and muscle spasms, and then in relation to sleep, because a lot of the secondary issues are keeping people up and not able to be functional throughout the day because they're not sleeping because of pain, or because of anxiety, a whole bunch of different issues that can happen, muscle spasms, and then they don't have the energy to go through to go to work or to volunteer or do anything.
Yeah.
So, yeah, this is a great topic. And honestly, this webinar has had the most chat out of any of the webinars. So
good. That's great. I mean, I think a good survey would be to ask that, like, people who use it with spinal cord injury, what they're using it for. Like that, you're kind of saying you think it's more for the secondary things or for spasm. It would be interesting to find that out.
Yeah.
And just get some more specific information.
It's well known within the community what its uses are, what its benefits are, but it's just not being spoken out loud outside of the community.
Well, and I mean, in Health Canada even had that in there when they had the Category 1 and 2. That was quite prominent in their Category 1 was for spasms and pain. They listed. So I think this is a good organization to kind of organize around that issue.
Especially.
You're welcome.
Just come in and
Thank
say
you.
goodbye to everyone here.
Yeah.
Is there any way people can reach you if they have any other questions?
Well, I have my email address up there.
Perfect.
So you can email me if you'd like to, and then you can also email any of those groups, the Canadians for Safe Access or Canadian Association of Medical Cannabis Dispensaries, if you have questions specific to them.
And that'll be accessed there as well. You can access contacts there.
Yeah, exactly. There's contacts on those websites if you want to ask those organizations
I'm
directly.
wondering if that link looks like.
What does it say?
MMAR Coalition Against
Yes.
Repeal.com.
Yes, thank you, whoever put that up there. Thank you. That's the group that I was trying to,
Okay.
that I was thinking of. That's
www.mmarcoalition against repeal.com. Interesting. Okay. Huh.
yeah. So I guess that's one of the groups, but I guess there's a, so the MMAR, the previous kind of regulations, or the current ones until the next ones come into effect, the medical marijuana access regulations are going to be repealed. That's the plan. And then these new MMPR, marijuana for medical purposes regulations, are going to come into effect. So I think they're not wanting that. They're against the repeal of the old ones.
So will the chat list be on the recorded sessions?
This whole, I believe the chat session and the video is recorded.
Just wonder if there's any way we can make sure that link gets.
Can you?
Make sure that link stays. I think that's one of them. That's not I don't think that's the same group. I think that's actually a group that might be doing some looking at a court challenge as well around that. And I think there's another group or two that's doing more on the ground kind of.
So we'll write this
Protesting.
down before we turn it off anyhow, and we'll make sure it gets out. It's good to see people are answering the polls. Let's go.
I should have that. I should have had that up on a window on here instead of looking at it on there. It's my first webinar. I'm learning.
Yeah, the internet access hasn't been good here. I've been using my 3G.
Oh, okay.
Okay, I'll get in there and I'll say goodbye.
Okay.
Okay, once again, thanks a lot, Rielle, for coming. I believe we have another webinar coming up on the same and talking about the pros and the cons and also discussing what people are using it for. And that's going to be coming up in some of our future webinars. For those of you who joined us today, thanks so much for tuning in. We do hope that you tune into more of our webinars, and let's keep this discussion happening. This chatting and networking is really good. I wish I could see some of your faces. I see some names up there I recognize, and it'd be great to see your faces. Norm and Dwight I recognize for sure. As well, this will be recorded so we can look back at it. If there's any information that you missed, you can check it out in our archives. That'll be up on our website and even linked over to on our Facebook page. We will have this topic on our Facebook page very soon, so let's keep up some of this chat and get some of the awareness out there to other people. And other than that, you guys check out the website for future webinars, and let's keep this discussion going. It's been good to see. Awesome. So thanks a lot, and thanks Brandy in Prince George for doing the background stuff. Fernando, who is usually hosting the webinars, is away this week, so I had to fill in, but it's been good. Okay, cheers.
Cheers.
Cool. Excellent. Thanks a lot.